Okay, this is the other version of the medical patient assessment dealing with respiratory issues. You'll get dispatched to a patient who is complaining of difficulty breathing or shortness of breath. So I have my gloves on. My scene is safe. Yes, my scene is safe. Nature of illness based on the dispatch information. We have one patient per dispatch info. We'll consider ALS coming depending on the severity of it, but we'll get them started. And we will consider C-spine, but we won't rule that out yet until we get on scene. So I arrive on scene. My general impression is a 30-year-old white male sitting at a desk in a clean environment. He looks to be in moderate distress. He's leaned over, he's clutching his chest. He looks like he's having a hard time breathing. I see environmental clues. I see some running shoes, some exercise clothes. He appears to be that he was just out running. So I'm going to determine my level of consciousness. Hi, sir. My name is Dave from MATC. What's your name?
I'm Scott.
Scott. Do you know what time of day it is?
About 9:30.
9:30. And what day of the week is it?
Monday.
And who's the President of the United States?
Trump.
Trump. And where are you right now?
I'm at work.
And Scott, why did you call 911 today?
I got some troubles breathing. I was running.
Okay. So he's determined his chief complaint is trouble breathing. His airway's patent. Scott, did you fall down or trip or hurt your neck or anything? So we're going to rule out C-spine, so we don't need to intervene there. How's your breathing right now, Scott?
It's a little labored, kind of tight chest.
Okay, so a little labored, tight chest. So we're going to put him on some oxygen, maybe a nasal cannula, maybe a non-rebreather at high flow oxygen. Quick lung sound check. We hear some wheezing, so we're going to keep that in mind. Scott, I'm going to check your pulse. So pulses are rapid and equal. His skins are warm, pink, and dry. I don't see any bleeding, so we don't need to treat for shock or do any interventions there. I might expose his chest area just to see if there's any trauma or just to get a better watch of his breathing. I think this might be asthma based on what I hear, but I'm not going to rule out anxiety or any cardiac related issues. And we're going to treat this as a high priority load and go patient. So Scott, when did all your breathing problems start?
Just after I got done running.
After you got done running. And is there anything that would make it worse or go away?
Sitting down helps a little bit.
Okay. And how would you describe the difficulty breathing you're having?
Like a tightness in my chest.
Okay. And Scott, is that tightness in your chest going any place at all?
No.
And on a scale of 0 to 10, with 0 being no difficulty breathing, 10 being the worst you've ever had, where would you rate this right now?
About a 7.
About a 7. And when did it start again? At what time?
About 15 minutes ago.
About 15 minutes ago. And have you ever had problems breathing before?
Yeah, I have exercise-induced asthma.
Okay, so we have our signs and symptoms figured out: difficulty breathing, tightness of the chest. Scott, do you have any medications that you're prescribed?
I do, but I didn't bring it with. I have an inhaler.
Inhaler. And do you have any allergies?
No allergies.
And pertinent past medical history?
Just that I have asthma.
Okay, and when's the last time you had oral intake?
I had breakfast about 6 o'clock.
Okay, and can you tell me again what you were doing before you had this breathing problems?
Just running.
Running. Okay, so I'm going to get a complete set of vital signs: pulse, blood pressure, respiratory rate, skins, pupils, pulse ox. We'll definitely do a good lung sound check on all quadrants. So pulse ox is 85% with oxygen. Lungs are very wheezy. Respiratory rate of 20. Blood pressure and pulse are normal. So my field impression is I believe he's having an asthma attack based on his medical history and what I find on his vital signs check. So again, secondary assessment, I'm going to do a complete lung sound check. We'll hook him up to end-tidal capnography. We'll hook him up to the EKG. And at this time, I'm going to get my breathing treatment ready. So my drug is going to be albuterol, 2.5 milligrams. And my patient is going to be Scott here, and that's the right patient for the medication. The dose will be nebulized at 6 liters per minute, and the route again will be nebulized, and the time will be right now because he is having the asthma attack, and this will be a protocol-driven medication. So I'm going to give that to Scott. I'm going to instruct him to hold the mouthpiece in his mouth, take deep breaths, and hold it in over 2 seconds, and then exhale. And my reassessment on the way to the hospital, I'll do my ABCs. I'll definitely check his airway and breathing, keep an eye on his circulation. I'll repeat the secondary and focused, so I'll keep listening to his lung sounds. I'll monitor the end tidal capnography, and I'll monitor his pulse ox. I'll evaluate his response to the treatment. So based on what I find in my assessment, I can determine if I need to give a second dose of albuterol. Again, and that would be just 2.5 milligrams in the 3 cc's. And we'll repeat a secondary set of vital signs every 5 to 10 minutes. And again, continue treatment based on what I find on my assessment.